Welcome to Your Vision in Focus. In this first episode of our two-part mini-series focused on the fascinating connection between optometry and audiology, we'll uncover the science, collaboration, and innovative technologies that bring vision and hearing together. Hi, welcome to Your Vision in Focus. I'm Dr. Vicky Zarinko, Eye Care Director at EssilorLuxottica, and I'm really excited about today's topic. Joining me today is Dr. Doug Beck, Senior Director of Audiology at EssilorLuxottica. Welcome, Dr. Beck.
Thank you. It's a joy to be here.
I'm so happy that you're here. Can you tell the audience a little bit about what you do?
What I do, I am an audiologist. I've been an audiologist for almost 42 years. And basically what I do with EssilorLuxottica is I'm trying to help bridge that gap between the knowledge of vision and the knowledge of hearing, because in the human brain, they actually coexist.
Yeah, it's really interesting. I'll make a little joke here, right? The eye and the ear are pretty close together, but audiology and optometry are also pretty closely linked. And a lot of the things that we manage in the eye do also manifest in the ear in a very similar way. Let's talk a little bit about how optometry and audiology can work together really for the benefit of our patients.
Yeah, so this is such an important concept. When we think about audiology and optometry, so clearly we're talking about vision and hearing. And in the human brain, we have synergy that occurs. So when we have audiology in isolation, just sound coming in, most of us can recognize that and make sense of it. And when we just have vision, we can do the same. But in challenging situations, we depend on those two systems working together synchronously in order to give us a synergistic response. So we get the idea of 1 + 1 = 3 or 1 + 1 = 10. And it's even more important in challenging, difficult situations, cocktail parties, restaurants, family gatherings, because you can almost always hear that somebody's speaking, but the question is, what are they saying? And that's the challenge.
So hearing and listening and understanding are really two different things.
Yes, I'm glad you said that. So hearing is just perceiving or detecting sound. Now, here's something that most people don't understand. The vast majority of people with hearing loss, which is 72.88 million people in the USA, the vast majority of them can hear, but they can't hear enough, and they can't hear clearly enough to make sense of what they're hearing, and that's listening. So hearing is perceiving or detecting sound. Listening is making sense of sound.
So what I know about hearing, or what I knew before, you came on board and we worked together a lot, is, if you have issues with hearing, here's a hearing aid.
Sure.
But really understanding it's not really that simple, right? Because hearing aids haven't sort of taken off where everybody who needs one is wearing a hearing aid.
Yeah, in fact, it's quite the opposite. So we know that in the USA, as I mentioned earlier, we have 72.88 million people with hearing loss. That's according to the Global Burden of Disease Study in 2024. People with hearing loss, it's kind of frustrating to know, but of the 72.88 million people in the USA with hearing loss, very few of them will ever seek hearing care help. And there's reasons for this, such as denial. People will often say, gee, I can hear. Yes, you do. You hear, but what you're not hearing are, generally speaking, the very, very high frequency sounds. It's important to know that 90% of the intelligibility of the English language comes from the high frequency. Sounds like st, ch, p, f, those sounds, those fricatives, those sibilants, that's where the intelligibility comes from. Now, unfortunately, what happens as we age and as we have noise exposure and ototoxic medicines, we lose the high frequencies first, and people can't tell. Because they say to their friends or they're watching TV, they crank it up to 11, and they say, well, I can hear. Of course I can hear. Yes, you can. So can 90% of people with hearing loss. But you're not hearing enough to hear clearly. So what we have to do in amplification through audiology, through hearing aid dispensers, through otolaryngology, we have to realize that it's the high frequencies that go first, and people will say, oh, well, everybody mumbles. Well, they're not mumbling. It's a very good observation on the part of the patient, but it's an incorrect diagnosis. The diagnosis is you have a high-frequency loss. That's why it sounds like everybody's mumbling. And this often shows up, again, in noisy situations, cocktail parties, restaurants, family gatherings. When you know people are talking, you can hear. So you convince yourself you can hear, and you can hear, but you're not hearing enough, and you're not hearing it at an appropriate signal-to-noise ratio to make sense of it. And that's what we try to do with amplification, particularly with nuance. It's a device that has an extraordinary ability to deliver an excellent signal-to-noise ratio because of all the microphones all around the eyeglasses. And that gives us the ability to separate speech and noise much better than we can with just one or two mics sitting back here behind your ear. When we have an array of 6 microphones across the frames, we can do a better job of directing the beam where we're looking. So if I'm looking over in this direction, this is being amplified the most. And if you start talking, of course, I'll turn my head here, and then I can hear you louder and clearer.
So you threw out a lot of really great information there. First, when I think of high frequency loss, I try to put it in terms of what I know as an eye doctor.
Sure.
So, and correct me if I'm wrong, but it's almost like trying to read a sentence without any consonants, right?
Exactly.
You see those things online or those little puzzles where they change some of the letters of a word, but you see enough of the word by context, you can figure it out, right?
Sure.
But if you gave me a sentence with all consonants, I could probably figure that out. It might take me a little longer, but I could figure it out. If you give me a sentence with all vowels, I'd be pretty much lost.
This is such a good point. When you do it all with vowels, that's the low frequency energy. And when you just have that information, it's almost impossible to know what somebody is saying. And that's what happens with most high frequency hearing loss. You can hear those vowels. The power of speech, 80-90% of the power of speech comes from the low frequencies, A, E, I, O, U, those sorts of sounds. But what you really need to be able to focus on is that's what separates the intelligibility factors in the English language. And it's true through most Western languages as well. It gets a little bit different when you start to talk about Indian languages and languages that are perhaps Mandarin, things like that. You have more vowels and fewer consonants. But for the Western EU, for North America, South America, it's pretty much consonant-bound sounds.
And you brought up you keep talking about the signal to noise ratio.
Yeah.
Can you talk about that a little bit? Exactly what is that?
Yeah. So what happens when you're in a restaurant and all of a sudden everything is really loud because you have 150 tables of people speaking. So then we all start to talk louder together, and that doesn't work because as I talk louder, the person at that table, they're hearing me talk, so they talk even louder. And pretty soon it's a race to the bottom. You can never win that. What we want to do, we want to reduce the background noise, and there's a couple of ways of doing that. One of the most common ways of doing that with hearing aids is amplitude modulation. So here's an example. When I speak, my voice varies in loudness, and that loudness is called modulation. Smart hearing aids, which we've had for 15 or 20 years now, can see that that's a human voice, so it does not attenuate or reduce it. The goal is to produce and allow the human voice to come through the hearing aid unimpeded. So what happens is you can take steady state noise like an HVAC system, fluorescent lights, the hum of your computer. Those are, and the hearing aid knows that's a steady state, so it's clearly not a human sound, so we can reduce that. We can use deep neural networks, which we've been using now in hearing aids for 8 or 9 years, and we can train them on language and voices and sounds so they know these are intelligent sounds made by human beings. We want to push those through the hearing aid. So there's lots of things we can do in this frequency and amplitude spectrum. But the most clever thing to me, and I would urge that this is the very best way to go, is to improve the signal-to-noise ratio so that the noise stays down here and the signal is up here. And in fact, there are speech and noise tests, which are very common in audiology, such as the QuickSyn, which is the quick speech and noise test, the AZ Bio, a test that I worked with Dr. Laura Benitez on. It's just simply called a 2-minute speech and noise test. These things, the whole goal is to see how people do in noise, and you can quantify it. And none of these take more than 3, 4, or 5 minutes. And it's the most important thing because when a patient comes to see me or any other doctor of audiology, he or she almost guaranteed their main complaint is going to be they can't understand speech and noise. And rather than just try to attack that, the first thing we want to do is quantify it. And then we know what the target is, how they're performing in noise, and we want to improve that. We don't want to generally improve it for everybody the same way. And it'd be the same thing if I came to see you as an optometrist and I said, gee, I have difficulty reading, everything is fuzzy, and you said, here are some glasses. You have to measure my ability to focus and to see and have normal vision, and then you know what you're trying to fix. And it's the same thing with hearing aids, whether they're prescription or over-the-counter. We need a baseline measure. And the most important measure to me is not actually the audiogram, which is pretty much the gold standard. The most important measure to me is their speech and noise score, because that tells me how they're doing functionally in the real world.
No, I mean, that's really, it can very much be paralleled in optometry. We take cell and acuity, how I read the chart. Yeah. That's a high contrast, black on white, but our lives are very gray and differing brightness, and there's contrast sensitivity, there's color vision, there's dark adaptation. I can't see at night, right? It could be I need new glasses. It could be I have macular degeneration. It could be any cataract surgery, but understanding that underlying issue is really important. You talked about, people maybe being in a little bit of denial as far as their hearing aids, but there are other reasons that people seem to shy away from hearing aids, and that the thing that is talked about the most is stigma, right?
Hearing aid stigma is the number one issue. And people got a little bit sidelined on this because in October of 22, the FDA said, listen, we need to have over-the-counter hearing aids because of access to professionals and affordability. So we all sort of bought into access and affordability as the primary impediments. But your point is so well taken. The number one impediment to me, and I'll say this after 42 years as being an audiologist, it is the hearing aid stigma, is the hearing aid stigma effect. And nobody wants to be that guy wearing hearing aids. When you wear hearing aids, it is pretty well known. You look about 10 years older than you are. You look less competent. And some of the literature from the 60s and 70s showed that when you have a picture, here's Dr. Beck unaided, and here's one with a hearing aid. The one with the hearing aid looks like your IQ is down 10 points. Now, none of that should be. That is all irrational. That is all crazy, but it is the way it is. People do not respond well to the appearance of a hearing aid. So now we have some form factors that are very, very cool, including nuanced audio glasses, because when you're wearing them, your ear is open. Nobody can tell that you're wearing a hearing aid. The only thing is you're communicating at a much higher level. And the sound quality is very, very good. If you go to hearingadvisor.com, Nuance won an award for excellent sound quality, and for speech and noise, they were in the top tier along with the prescription hearing aids.
So let's sort of dive deep into Nuance, because that is really where vision and hearing come together.
Sure.
Before we go into Nuance, the product itself, let's talk a little bit about why I, as an optometrist, should care about hearing.
Yeah, this is a good question. When you are seeing people who are in their 50s and older, you're almost assured that they need vision correction of some sort or other. I don't know the numbers. I'm not an optometrist, but I would suspect 99% of everybody by age 50 needs some sort of vision correction. Some of them are going to not do it because they just don't want to. That's fine. But it's the same with hearing and hearing loss. Well, we think in general, we used to say, if we use an audiogram as a gold standard, 1/3 of people by age 65 have hearing loss. 2/3 of people by age 75 have hearing loss. That's based on an audiogram. But you have to understand the limits of an audiogram are vast. The lowest note tested on an audiogram is 250 hertz. I am a professional musician, so I will just tell you that's middle C on a piano. So everything on the lower half of the piano is not reflected at all on an audiogram. And the highest note reflected is 8,000 hertz, which is problematic because human hearing goes out to 20,000 hertz. So you could functionally lose 20,000, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9,000 hertz before anybody would say you have hearing loss. And that's a huge problem because having that hearing loss in those extra high frequencies makes it difficult to understand speech and noise, can be the origin of tinnitus. There are many people who have tinnitus caused undetermined, but if you look at their high frequencies beyond 8,000 hertz, you'll often see lots of damage up there. So this type of damage is referred to generally as auditory neuropathy. We have that going on, and we have cochlear synaptopathy, when the synapses between the inner hair cells and the eighth nerve are not firing correctly. Could be mechanical, it's most likely chemical. Those sorts of situations occur, and none of that's reflected at all in audiograms. Then you have the big one. The big one is speech and noise. And Dr. Danauer and I published a paper in 2019 that's peer-reviewed, and we said there's 26 million Americans who have absolutely normal hearing, but they have hearing difficulty and they will complain about speech and noise. So these are called subclinical hearing loss. Some people refer to them as central hearing. Some people use the term auditory processing disorders. Some people say supra, S-U-P-R-A, supra-threshold listening disorders. They're all pretty much kind of sort of the same thing. In other words, your hearing test, your normal audiometric test looks fine. Everything looks great. The only thing is you can't understand speech and noise. And people tend to mumble, and you have tinnitus. None of these things can be discovered on an audiogram. So the bottom line, and I think it's true in vision, but you tell me, you need a comprehensive evaluation. Hearing screenings they can't discover any of these things. They're all going to be normal on most hearing screenings, even though the patient has a plethora of difficulties that are easily discovered when we're doing best practice clinical work.
Yeah, what you describe, the thing that I think about is a visual field. It would almost be like testing the central 10 degrees of a visual field.
Right.
And because that's your macula, that's where your most acute, and clear vision is. But so much can happen before that's ever affected, especially in something like glaucoma. You can lose vision out here long before it ever affects, and also to your point, there are still other types of vision. There's, again, visual acuity, contrast sensitivity, color vision, all of those things can also be affected. And hearing didn't undergo sort of the renaissance that vision did, where people want to wear glasses now, and they wear them for different reasons, right? Some of them just, they're on a computer for blue light blocking help, and kids always kind of want glasses. We always have to make sure that they don't actually need them, but yeah, because they think it's cool. But hearing, and you talked about the studies that, although it is unfair and a little bit irrational, somebody who is wearing a medical device that they need to be able to function in the world, they're viewed as being, like you said, less intelligent or even older. And that's sort of unfair.
And it is. And this is very, very common. There's a recent study that came out this summer in 2025 by the Irish and the English Hearing Aid Manufacturers Association. They surveyed 200 audiologists in the UK and Ireland. And what they found was very interesting. About 96% of all hearing care professionals say, yes, stigma is a big factor. And patients, even when hearing aids are free, do not seek hearing aids. And we know this from the studies by Valente and Amlani back in the American Academy of Otolaryngology Head and Neck Surgery, where they found that in countries where hearing aids are free, like the entire EU, the UK, Canada, New Zealand, Australia, all of Scandinavia, where hearing aids are free, 60% of people with hearing loss say, no, I'm good. And it's not because the hearing aids don't work. They work magically. They are an incredibly sophisticated device. And nobody would argue that they aren't fantastically well engineered and that they're so useful for people. But people just don't want to wear them because they don't want to be the guy wearing hearing aids.
Yeah, I mean, you've laid it out really well here. There's, even in the U.S., the FDA worked on price and accessibility. So hearing aids are more accessible than ever. But we know from other countries where hearing aids don't cost hardly anything or are free, there's still not this uptake. So it really is this stigma. And hearing aids have come such a long way. There's so many different form factors of them, even for standard hearing aids.
Sure.
They're can be very small and very discreet. Yeah. But again, we still haven't been able to find that thing that, will make people adopt these, because it's really important. And again, going back to why you care about hearing so much, and I care about vision, but I need to care about hearing more. Vision and hearing loss together can have detrimental effects in overall quality of life and patient health. Can we talk a little bit about that?
Yeah, so there's a new paper coming out, in about a week, that you and I co-authored on dual sensory impairment. And the way that this works, if you go back to 2017, 2020, and 2024, the Lancet, the world's foremost medical journal, and the group of docs who wrote this was led by Dr. Gil Livingston. They talk in general terms that your entire risk of dementia, everybody watching this video, your risk of dementia, about 50% of your risk is due to DNA and age. So deoxyribonucleic acids and age, and you can't do anything about those. The other 50% of your risk for cognitive decline is due to 14 potentially modifiable risk factors. The number one potentially modifiable risk factor is hearing loss. And then we get into things like, uncontrolled diabetes, blood pressure that's not controlled, vision loss, alcohol, drug abuse, all sorts of things that are behaviorally managed. And
education level.
Education level is huge. That's one of the constants in all of the studies, is that the more a person is a lifelong learner, the more interested they are in socializing and participating in events, the better it is for their brain. One of the worst things you can do is be socially isolated. And what happens when you have vision loss and hearing loss that's not corrected? You become socially isolated because you can't communicate comfortably and you can't be a part of that. And so you tend to stay home and you crank up the TV and you do nothing and you watch TV. So being a lifelong learner goes a long way. And there are so many examples of children who have had deficits related to, learning disorders, attention deficit disorder, attention deficit hyperactivity disorders, all sorts of behavioral issues. And what we find is when we really focus them with their vision and their hearing, we can get a better result, and they can have a better quality of life. This is so true of children with auditory processing disorders, which is probably 15% of all children. And they have normal hearing, but their brain isn't able to sort what to pay attention to or where the sound is coming from, which you and I know without even trying. We have that for free. We don't have to try. But a child with auditory processing disorders, he or she has no idea where the sound is coming from. The teacher's talking over here, but the kid is listening over here because there's a sound here, and their brain can't tell them what to focus on. So what do we do for that kid? Well, we often will use Bluetooth devices. We will use remote microphones. We will use hearing aids. We will use all sorts of things to give them a more accurate representation of what they need to pay attention to. It's not just people with hearing loss who need a better signal-to-noise ratio. It's children with all sorts of learning disorders. When they have the signal, it's so much easier to attend to, and the noise is way below them, it's easier for them to focus. One of the things that we found out of studies in Australia, when you take a child with auditory processing disorders and you do a really, really good job with FM systems, direct digital remote mics, hearing aids, all these tools, 2 or 3 years later, the child may not need any help because now the brain has been trained to know what to pay attention to.
Now, and we wouldn't let hearing loss or vision loss linger in a child. We are jumping on that right away. Yet, as we become adults, there are these, other things that come into play. And again, we talked about the stigma that prevents us from really taking care of ourselves, right? Yeah. We also started this conversation talking about synergy and, dual sensory impairment, vision impairment, and hearing impairment. Unfortunately, they also have a synergy when it comes to the development later in life of dementia.
That's right.
So it is not a 1 + 1 = 2. It's actually you end up with an 8x effect on patients at risk.
That's exactly right. And what happens now when we talk about older patients, perhaps people in their 60s, 70s, 80s, and 90s, as they have high frequency loss, they get more confused by the sounds because their auditory system is failing them. They are not able to take in as much information as they need to make sense of it. That's where hearing aids are particularly useful. When we are able to supplement the amount of auditory information going to that brain, it's easier for that brain to make sense of the world.
Thanks for tuning in. We hope you enjoyed today's conversation on the connection between optometry and audiology. Be sure to join us for part 2 coming soon, where we'll take the discussion even further as we explore new innovative technologies.